Hello, my dear students. The topic of today's lecture is anti-inflammatory drugs and anti-allergic drugs. And we are going to start with the definition of inflammation. So actually this is from pathophysiology, and I think you have already studied that. Inflammation is a complex of protective response of the organism to injury caused by damaging agents. It is aimed at inactivation or removal of these agents and promoting healing. Actually, inflammation is not that bad as we think because it is dedicated on our protection. But what happens really in our lives is that the protective inflammation starts developing too much and producing more and more pathological process around itself. So that's why we actually want to treat that. The signs of inflammation, traditionally we name them on Latin: dolor, this is pain; color, this is heat; rubor, this is redness; tumor is swelling; and functionality is the loss of function. So actually these all signs you know again from pathophysiology. So there are many different mediators of inflammation: prostaglandins, bradykinin, serotonin, histamine, interleukins, platelet activating factor, the different interferons and factors which in combination stimulate all those signs of inflammation which we have seen on the previous slide. They dilate the blood vessels, they increase the body temperature, and so on. Today we are going to talk a lot about the group of prostaglandins. And prostaglandins, they are like it's not just a one molecule; it's a group of molecules. It's a family of molecules. And here you can see some functions of the prostaglandin. So the prostaglandin E2 is responsible for vasodilation, bronchodilation, inhibition of gastric acid secretion, stimulation of gastric mucus secretion, sensitization of pain receptors to chemical and mechanical stimuli, promotion of anterior pituitary hormone release. Prostaglandin F2 alpha, uterus contraction, bronchoconstriction, decrease in intraocular tension. Thromboxane, it is produced by platelets and it makes the induction of platelet aggregation and vasoconstriction. And prostaglandin I2 is responsible for inhibition of platelet aggregation and potent vasodilation. So here you can see, for example, in thromboxane and prostaglandin I2, they are antagonists. Yes, this will induce the platelet aggregation. This will inhibit the vasoconstriction, vasodilation. Okay. Also, I want you to pay attention on that. Prostaglandin E2, for example, is responsible for bronchodilation, but F2 alpha for bronchoconstriction. And also the effect on uterus will be important for us in some next topics, because we are going to study that drugs affecting uterus. Okay, the cyclooxygenase. Our drugs will affect on this important enzyme, so we should understand what is this enzyme. Cyclooxygenase, COX in different words, or COG, which you will meet in the lecture book, Lectures on Pharmacology. So this is the enzyme which exists in the tissues, and we have one constitutive form, cyclooxygenase 1, and also we have the inducted form, cyclooxygenase 2. What does it mean? It means normally we have always cyclooxygenase 1 in high concentrations in our body, and it has some functions. And in the site of inflammation, the cytokines will stimulate the induction of the second isoform, cyclooxygenase 2. That doesn't mean that normally we don't have it. Normally we also have it, but in low concentrations. And if we have inflammation, cyclooxygenase 2 will increase in the site of inflammation. So inhibition of cyclooxygenase 2 is thought to be due to the anti-inflammatory actions of non-steroid anti-inflammatory drugs. So we are going to talk about this group of drugs, non-steroid anti-inflammatory drugs, and they inhibit the cyclooxygenase. And especially inhibiting of the second isoform gives us anti-inflammatory effect. Again, why? Because second isoform is produced predominantly in the site of inflammation. And inhibition of cyclooxygenase 1 by these enzymes. The first, yes, the constitutive for isoform of cyclooxygenase 1. If we inhibit, it gives us GIT toxicity. So the toxicity of gastrointestinal tract. Okay. And most currently used non-steroidal inflammatory drugs are somewhat selective for cyclooxygenase 1, but selective cyclooxygenase 2 inhibitors are also available, and they are also used and indicated for the patients with chronic inflammatory diseases. Okay, so now we'll talk about non-steroidal anti-inflammatory drugs more properly. The non-selective cyclooxygenase inhibitors, which inhibit both cyclooxygenase 1 and 2, yes, 1 and 2, both. They are acetylsalicylic acid, aspirin, everybody knows them, salicylamide, phenylbutazone, metamizole, sodium, analgenum. By the way, we have already discussed this drug on our topic non-narcotic analgesics, yes. Indomethacin, naproxen, mefenamic acid, diclofenac sodium, piroxicam, ketorolac. Ketorolac also we have discussed before. So these drugs are non-selective, which means they don't select, they just block both cyclooxygenase 1 and cyclooxygenase 2. Okay. We also have some selective cyclooxygenase inhibitors, which are preferential. No, it means like more percent of inhibiting the cyclooxygenase 2, but a little bit inhibiting the cyclooxygenase 1. Right? So it inhibits cyclooxygenase 2 more, plus a little bit 1. And cyclooxygenase 2 inhibitors, which are selective, that means they block only cyclooxygenase 2. Okay, and to the first group we have the drugs mimisulide, meloxicam, nebumetone, and the selective, which are celecoxib, paroxib, erotocoxib. This is easy to remember these coxibs. Okay, these drugs, which are more inhibiting cyclooxygenase 2, they cause little gastric mucosa damage, and they also do not inhibit the platelet aggregation. About this mucosa damage and platelet aggregation, we will talk a little bit later, but you should remember that selective drugs, they have less such side effects. Okay, so you see less side effects from gastric mucosa and less side effects on the blood. Okay. So, I cannot. So, let's discuss the mechanism of action more properly. We have again, we have two cyclooxygenases which are approved. How to say it? Yeah. Cyclooxygenase 1 and cyclooxygenase 2, which we have already discussed. And also we have one type, cyclooxygenase 3, which is just recently discovered, and actually it is not approved. We are not really sure, do we actually have this cyclooxygenase 3 or not. And if we have it in our CNS, and it is responsible for the temperature, of the body. Okay, so blocking the cyclooxygenase 3 in the CNS by the drug acetaminophen, paracetamol, in other words, reduces the body temperature. Okay, what is the function of cyclooxygenase 2? The function of cyclooxygenase 2 is the production of prostaglandins. Right? Remember that. The prostaglandins can be produced only with the help of the enzyme cyclooxygenase. I want to show you also the whole mechanism of production of prostaglandins, and I will do it right now. So pay attention on this scheme right here. What this scheme? What can we see here? The phospholipids, which are components of the cell membrane, from the membrane, they are affected by the enzyme phospholipase A2. This enzyme breaks the phospholipids with the formation of arachidonic acid. Arachidonic acid then will be converted with the help of this enzyme cyclooxygenases. So with the help of cyclooxygenases, will be converted into cyclic endoperoxides, which are lately, with the help of prostaglandin synthase and thromboxane synthase, will be converted into prostaglandins and thromboxane. About prostaglandins, we have talked already. Prostaglandin E, prostaglandin I, prostaglandin F2 alpha, and so on. They are actually the reasons of the inflammation, pain, and fever. So why? Inflammation. Prostaglandins, they are responsible for the dilation of the blood vessels, and it forms what? Redness because of dilation of blood vessels. It gives us the swelling because of liquid which goes from the blood plasma to the tissues, and also it makes sensitive. I think I have to write it here because you will forget if I don't. So inflammation because of dilation of blood vessels. Dilation of blood vessels. Okay, why pain happens? Why pain happens? Because prostaglandins are responsible for sensitization of the nociceptors. Nociceptors, I hope you remember, these are receptors of pain, the pain receptors. So sensitization, that means that by affecting on these receptors, they are made more sensitive, okay? And fever, it's easy because there is a special thermoregulated center we have in our thalamus, and the prostaglandins, by affecting of this thalamus, activate you understand, activate this center. Okay. Well, next, thromboxane, when it is formed also out of arachidonic acid and cyclic endoperoxide, it is responsible for vasoconstriction and increasing of platelet aggregation. So guys, you see these two effects, they go close to each other. That's why when we will talk then about the effects of non-steroidal anti-inflammatory drugs which inhibit this scheme, they will not just only reduce inflammation, pain, and fever, but they also will affect on the blood, on the platelet aggregation, yes? Because the thromboxane is actually also the product of arachidonic acid. So I hope you will see this and remember this. Okay, so what should we say here? The non-steroid anti-inflammatory drugs, they are responsible for inhibition, the inhibiting activity, you see minus here is, inhibition of cyclooxygenase. So it stops, they stop this procedure on this side. So arachidonic acid will form, but cyclic endoperoxides will not. That's why we'll have less prostaglandins, less thromboxane. And all these effects will reduce. Less inflammation, less pain, less fever, less vasoconstriction, and less platelet aggregation. Talking about the glucocorticosteroids, they are steroid anti-inflammatory drugs. So we have NSAIDs, non-steroid anti-inflammatory drugs, and we have steroid anti-inflammatory drugs, SAIDs. And they work on the level of phospholipase A2. You see also inhibiting the phospholipase A2, so blocking the process here on this stage. So even arachidonic acid will not form, okay? This scheme you should know. You should know it just for ideal remembrance. Okay, this is the scheme of back. Sorry. No. Come back. So here we have already discussed that. Let's go further. Okay, pharmacological effects of non-steroid anti-inflammatory drugs. As we already said, by inhibiting cyclooxygenase, we reduce prostaglandins. It means that we reduce inflammation. Also, as analgesic action they can give because nociceptor sensitivity will also reduce because less prostaglandins. Antipyretic action, why? Because reducing the body temperature according to effect on the thermoregulatory center. And the platelet effect, reducing the platelet aggregation, especially this is important for aspirin. I will later tell you why. And closure of ductus arteriosus in newborn. This is the specifics of the newborn's blood flow.